So, what does it have to do with? It has to do with two things. Number one, it has to do with always using correct therapeutic pressure, okay? And we're going to get to that in a second. And number two, because I was working on Vermilion Orange's upper back pain, it has to do with using the patent pending 4-step TrapEAZE technique. So we'll talk about that a little bit more also. But let's talk about using correct therapeutic pressure. So if you're using incorrect therapeutic pressure, but you're basically doing one of two things. Either you're using, number one, you're using too little pressure, or number two, you're using too much pressure, okay? If you're using too little pressure, guess what? You're not doing anything, you're not accomplishing anything, you're not getting deep down into the muscle tissue where that pressure needs to be, okay? Now, if you're using too much pressure, number one, you can injure the patient. Number two, you can cosmetically, you can break blood vessels. I'm sure there's a few other things that you can do. So, moral of the story is you always want to use correct therapeutic pressure. And number two, because again, I was working on Vermilion Orange's upper back pain, I was using the 4-step TrapEAZE technique upper back pain system. So you put those two things together and you get golden hands.